Hi, my name's Dr. Keith Maitland. I'm a chiropractor and an applied kinesiologist. Chiropractic for me is all about listening to patients to find out what is wrong with them. First thing is, when you come to me, it's all about an interview. How long have you had the problem? What makes your problem worse, better? Who's tried to correct it? The next thing I do is give you what's called a thorough chiropractic examination. And I'm going to show you that in a minute. In my interview, it's all about finding out what the problem you have, where it is, how long you've had it. The next step is looking at your posture. So the first thing I'm going to do in this video is show you how I do a postural examination. So the first thing I do when I'm looking at someone's posture is check the posture from behind. Now you can do this on your own children, personal coaches could do it on their clients, physiotherapists, we could check on our clients as well. The whole thing is this: when I treat someone's spine, I'm looking for changes in people's posture and their spine. Okay, so the first step, look from behind. So I'm looking for a level crest. This is the pelvic crest, iliac crest. I'm now looking for a level shoulder. This patient's shoulder's a little bit dropped on the right. And then I'm looking at what's called the bottom of the skull. You could do the ears if you want. And this patient's ears are a little bit down on this side, on the right side. Turn around, please. So the next thing I do, turn around. The next thing I do, which I find quite interesting, is I then look at the posture from the front. Sometimes I actually find posture from the front to the back looks different, but it gives me information. And these are the sorts of things, once I've treated someone, that I'm looking to change. If you're a personal trainer and you send someone to a chiropractor, a physiotherapist or an osteopath, you could check the posture and make sure the chiropractor or the physio is making changes to that. That way you know the treatment is working. So again, we look at this patient's pelvis from the front. What I see here is the pelvis is a little dropped on the left side, but it seemed okay from behind. So isn't that interesting? The shoulder looks a lot better from the front and the ears look a lot better. But this is how you do it. You look front and back, gives you more information. The next thing is we look from the side. When you look at someone's posture from the side, you're actually looking to see if the ankle bone is over the hip. All right. This patient's a little forward, not too bad. Then you're coming up to the shoulder, the tip of the shoulder here. Is that over the hip? And then there is the ear over the shoulder. So that's sideline. The next thing, which I think is quite a unique test, is I then back a patient up against the skirting board. Now what I'm testing for is rotation in the body. This is really important, particularly for athletes. If your body's not totally balanced all the time when you're running, if your body's, say, twisted a little bit to the left, what happens when you run, you obviously don't run to the left, so you're twisting yourself all the time. So anybody with, say, something like a persistent hamstring problem, persistent back problem, get yourself checked to see if there's rotation in your body. So I'll show you how to do it. What you're looking for is you put your hands on the pelvis and you're looking for rotation. This patient is a little rotated to the left. Again, in the shoulders here, I'm coming on the shoulders, having a look. All right, it's pretty good at the top. And then what you can do now, this is where my height helps me, is you can just look from the front. So what I see with this patient is a little bit of rotation. So that's a thorough spinal analysis or a postural check of a patient. Here's how I perform a chiropractic adjustment. I'm also going to show you how I use applied kinesiology to actually determine where to adjust. I'm going to use applied kinesiology to show you where I'm going to adjust and how I'm going to adjust something. Push here, this patient goes weak. So that tells me she's got a weakness on that side. So then I know what to do to fix that with a chiropractic technique. See how I'm using applied kinesiology? That's the muscle test. And then I'm using chiropractic techniques to actually realign the spine. Push out hard. If I want to check the neck, I just come up and push on the neck. So I push Pete away on the neck. Boom, she goes weak. So that tells me she's got a problem on this side of her neck. On the first vertebra has rotated to the left. So that tells me how to fix that. So now I'm going to show you what I do to fix things using chiropractic techniques. So the first thing is a manual manipulation. So this is, you get behind a patient and you just get very gently, I use very gentle techniques, and you just very gently adjust, click like that. And sometimes we might lie someone on side, lie on your side. And this is how we'd fix the low back, boom, like that, on your back. Patients don't like being manually manipulated. Some patients don't like being manually manipulated, but that's okay. Because in that case, I use a little thing called an activator. I also use this for children because they're too small to adjust. So this just goes a little activator, it's a little percussion hammer. So this is how you receive that sort of adjustment. Turn your head to the right and you just come in the neck and you adjust it there. It's the same with the back. Lie on your side. We'll use the little gun just in the side, boom. So you can see a chiropractor can make an adjustment to your spine very gently, or depending on the person, with a little bit more vigorousness. Sometimes it can be done with a gun like this, or sometimes it can be done by manual manipulation. So that's how I do my chiropractic at my office.